thanks again, Glenn, for agreeing to do the interview with us. So, for
Yeah,
those who don't know you, I think most people in Horizon Pharmacy know who you are, but if you'd like to give a brief introduction of who you are, where you work, and what you do.
sure. So my name is Glenn Whiteway. I've been with Horizon now for 18 years. Um, been in Fredericton for all that time. I have moonlighted at other sites when they've had staffing challenges, but strictly my practice is at the Dr. Everett Chalmers Hospital. Um, I am a pharmacy clinical manager. I did have a brief stint as operations before Brent took over, but I've been clinical manager now for just over 10 years. And yeah, my primary practice is in ICU, and I quite enjoy it.
Okay, great. And is that where you were covering when COVID hit, was in the ICU?
Yes, yeah, and quite a busy time. Of course, there's the component of the unknown. What did this mean for us as healthcare workers and as members of the public in a greater community? But then we had to prepare to ramp up our ICU bed availability as all other sites had. So that was definitely the most trying part of it.
Yeah, it was increasing the number of beds.
Yeah, so
Yeah.
here at this site, we essentially were planning to triple the number of ICU beds.
Oh, wow.
So, so we went from an 8 bed to 26, actually, 26 beds. So setting that up in the span of a week and a half took a lot of effort, and so we worked with the physicians, nurses, nurse managers, and myself, and all the pharmacy team supporting me, making sure we had meds available, med stock set up for areas that didn't traditionally set up or ever stock these types of meds. So, and having resources at the fingertips of the frontline staff. So, yeah.
Did you guys see many patients admitted to your ICU there?
So we did have two patients. Of course, I can share that because it's in the media. But yeah, we did have two COVID positive patients in our ICU, and we had a few more that were less sick on our inpatient floors that we had designated as well. And those pharmacists for our inpatient family medicine unit worked hard and worked very closely with physicians and nurses to make sure that they had all the resources on their unit because it was a big change for them as well. So everything from drug dosing, drug protocols, orders, stock, reviewing everything available in the AcuDose, paring it down, making room for critical care meds, making rapid sequence intubation kits. So the whole team pulled together to make that happen.
That's good. Did you personally see to your clinical practice many changes during the last couple of months?
Um, Not really, not the day-to-day clinical part. The busy part, the insane part was getting ready to be ready for the onslaught of patients that we were first expecting, and thankfully we didn't see that. A minor change was, when first receiving a patient with COVID, they were in a segregated wing of the ICU. So relied on telephone interview with a spouse as a source for my BPMH, which that would usually be done at the bedside, even with isolated patients. But we were just trying to initially avoid unnecessary contact. So the nurse, as a spouse, was able to answer the questions. So that also avoided me having to go in and waste PPE that I wanted to save for my nursing coworkers who had to be in there for 3-hour stretches in the isolation area. So yeah, so that was a slight change, and now because of that, I guess one of the spin-offs of this whole crisis is now that Horizon and other healthcare providers are looking at other means of providing care. So using web apps, Zoom, IMD, those types of things. So it's forcing change, adaptation, which is good. And now we're finally getting some resources that we've been asking for years. So it's come at a great cost and a crisis, but finally seeing some improvement and looking beyond, the way we operate on paper and moving that to electronic realm.
Mm-hmm. Oh, that's great. My next question was going to be, do you think any of these changes have been for the good? But it sounds like a lot of the technology stuff will improve our practice going forward.
Yeah, doing e-consults like through the IMD app and the ability to use iPads. We've incorporated iPads here on our family medicine floor in the COVID designated area. Uh, that's been positive. We haven't done that in the ICU, but certainly that would be helpful. Of course, in the ICU, it's the sickest of the sick, and they're usually ventilated, so an iPad wouldn't be of help there unless you were going to try to remotely contact the spouse or other caregiver. But yeah, there's still lots of exciting things, and you know what? Moving all of our meetings and CMEs onto Zoom and webcasts isn't bad either. It cuts down on travel time
Yes,
and
absolutely.
makes things more efficient.
Sure, great. Looking back, like on the last couple of months, what would you say was your biggest challenge?
I think the biggest challenge was just dealing with the unknown, and also as a manager, trying to help your coworkers remain calm and wait for information, wait for evidence, and reassure everybody. That was very hard because you know we're inundated with social media and then legitimate news source media. Um, and we hear it all day at work. We hear it all day when we go home. There was no downtime or off time. I even found myself looking at the news more often,
Mhm.
whether it's on the TV or on my phone. And so we were all in a heightened state of awareness and anxiety. So trying to navigate that yourself personally, and then as a manager trying to help your staff who are looking for answers as well. I think that was one of the most challenging things. But you know, again, it was quite a frenzy in the first few days and weeks. But as things became clearer, everyone seemed to, okay, take a breath and say, okay, yes, now I am a scientist. I can think about this logically. And our staff, you know, kudos to them, adapted quite well. And then we could look at things in a more pragmatic manner.
Mhm. What have you learned about yourself or your team members through all of this?
Well, I mean, we've got a great, as I'm sure our other sites could say, we do have a great team, and everyone helped out. All of our pharmacists, technicians, and assistants. Everyone pulled together to make things happen when we were setting up things, to maintain inventory, to distribute inventory, to switch shifts, to make contingency plans in case half of us were out sick. All those things fell into place. And also our regional management team were there. They supported us top down and with encouraging messages, frequent communication. So it was just, I guess, somewhat now in retrospect, although we know there may be a second wave, and but really it's good looking back to see how everyone in our department, as regional department, collaborated. It was very reassuring. So I'm very proud of the team that I'm a member of, both at our site and at our region.
That's great. Thank you, Glenn. We're
Yeah.
lucky to have leaders like you and Carol up in Fredericton and all of our regional team and site managers. So I think that was all of the questions that I had for you. If there's anything you want to say in closing, I'll open it up to you.
Not much, just thanks to all the other sites as well, because you know there was a lot of intra-site and inter-site collaboration, sharing. You know, the weekly and daily Skype calls. It's just been great sharing resources and ideas and how to improve the way we do things in a very accelerated manner. So, you know, and all your CMEs and webinars that you're sending out, Heather, have been great. So we can keep expanding our brains during this difficult time
Yes,
and trying to keep up to date.
that's great. Thanks, Glenn.
Okay, have a good day.
Thank you. You too.